that'll be serious, that one, isn't it, Good morning. My name's John Kennedy. I'm Director of Care Services for the Joseph Rowntree Housing Trust and Foundation, based here in York. And we're a research organisation, but also we're a provider of social housing and care and support for older people and supported services for young adults with learning disabilities. What I was asked to do is just talk through a project that we completed last year. The evaluation was published in July of this year, which was looking at loneliness as an issue, and particularly as in neighbourhoods. So I'll take you through the project and why we did it. Loneliness. When we started thinking about this 3 years ago, we had a bit of a debate about should we even use the word loneliness, or should we make up some other phrase like well-being or something that sounds a bit nicer. But in the end, we decided that no, loneliness, we'll out it. We'll actually see how we get on the streets of York and Bradford, talking to people about loneliness. And the reason we settled on it is we run retirement communities, for example, quite a long time, and some of the evidence that's coming out is how people feel about the experience of living there, but also the levels of sort of high levels of care seem to be compressed, seem to be less, for example, than people who might be living out in the community. When we asked them, it was nothing to do with us. It was nothing to do with the place that they live. It was actually about the neighbourliness and the access to social interaction that people said was the real fundamental thing that made them feel better and made them get out. And at the time as well, there were quite a lot of, there was a number of medical type reports, mental health foundation, etc., starting to put this link between isolation and loneliness and a real impact on people's health. And I think that's becoming quite a mainstream medical view now, that mental health and loneliness and physical health are closely linked together. We will look at what loneliness is, if you like, and it, the mismatch of the relationships we have and those that we maybe want. And it has been described in a sense as an appetite. Feeling lonely is the thing that spurs you to go and seek company, just like feeling hungry spurs you to go and eat. And there is a difference between loneliness and solitude. We do like to be alone sometimes. It's a perfectly natural thing to do. It's when it's a very unchosen thing and people don't have access to social networks, etc., that people can start to feel lonely and start to withdraw and become isolated. A bit of an idea of the issues. It's estimated that almost 50% of adults in England say they experience feelings of loneliness. And half of older people, which is over 5 million people, say that television is their main company. And on average, 10% of the population over 65 are often or are always lonely. Now these are figures around older people, but I would like you to think, because when we go a bit further through, the issues that came out was actually loneliness is something that doesn't just affect older people, it affects younger people, and then that group, of which I'm in the middle, the sort of middle-aged, who don't usually come up in any statistics, but they get very lonely. And a key issue that came out is you don't actually have to be alone to be lonely. There are lonely people who live with other people. So that's quite an interesting thing to think. So a serious risk to health. People, in seeking some sort of feeling of betterness, people look into other things if they can't get company. So people's behaviours can change in terms of what they eat. Smoking and drinking can become issues, which this is not medical theory about why people are more vulnerable to alcohol problems, they eat less well, are more likely to smoke and be overweight, and are less likely to go out and engage in physical activity. So if you're feeling lonely, you're not very good about yourself, you haven't got any engagement, are you likely to go out for a jog, or are you likely to open the candelabra from the fridge? But you're most likely going to open the candelabra from the fridge. Then leading to other behaviours. So what did we do? We wanted to look at loneliness, and we wanted to do it very much in a place-based approach. So to looking at neighbourhoods, actual places where people live. We wanted to do it as an asset-based approach, an appreciative inquiry approach, to look at what is good in areas and what was working well. To talk about loneliness, just get it out in the open. Do you think loneliness exists in your neighbourhood, or do you think it doesn't exist? And see if we could get some community engagement around that. We chose 4 areas. It was a tale of 2 cities, 2 in York, 2 in Bradford. We as an organisation had at that time a 10-year commitment working in Bradford, so it was a natural place to go, and obviously we're based in York. The 4 areas that were chosen, one was a place called Carr Estate, which is between Beckfield Lane and Carr Lane, in just around the corner from where the video was shot on Acre Front Street. And when we spoke to the City Council and other people about what neighbourhood in York would be a good one, and we actually started thinking about Axby, and said, no, why don't you go to somewhere that we don't, that isn't quite as resilient like Carr Estate. We know a lot about certain areas in York, but Carr Estate we don't know a lot about. So we decided to do that. Newish, because that's our own stamping ground, that's where the Housing Trust is based. And then the 2 areas in Bradford, again, were 2 different ones. One was a place called Denhoe, which is an interesting place. If you went past it, you'd think it was quite rural, but it's actually it used to produce a lot of cloth. The mills have relatively recently closed down, and it's on top of a hill. It's got 7 miles of road, 7 miles from Keighley. Quite an interesting place. And then Bradford Moor, which is on that east side of Bradford as you come in from Leeds. A very deprived area, high levels of overcrowding, and very deprived as well. So there were 4 very different areas. What did we do? Well, we recruited a programme manager, a woman called Tracy Robbins, and we deliberately made the resources of the project limited. Because what we didn't want to do was the usual, where you put a whole load of effort in, you do something for 3 years, project comes to an end, people leave, and the whole thing just stops. And one of the real key things we wanted to try and create some legacy. One of the reasons we thought we would do that is don't give too much, don't put too much effort into providing resources. See if we can get the groundswell in the neighbourhoods itself. And what Tracy did was going around all those neighbourhoods was literally set up a washing line outside the Fort supermarket and mug people who were walking past and say, do you think there's lonely people in your neighbourhood? If there are, how much loneliness is there? Put the sock, if there's lots or there isn't. And this has just got people talking about it. And from that, we recruited across the 4 neighbourhoods, in total about 32 what we called community researchers. These were just volunteers who were interested and said, yeah, I'd like to find out more about this. And we gave them some training in confidence building and participatory learning and action for the neighbourhoods, and then basically let them loose. And they went off and started putting on washing lines and asking people. And we spoke to over 2,000 people over the course of, with individual comments, and there were 7,500 individual comments from people. This was really quite detailed work. So there'd be a fair run in Denhoe, and there were lots of people, and the community research said, what do you think about loneliness? Who do you think is lonely? Why do you think they're lonely? What can we do about it? And every comment was taken down, matched against that person's age, that's dependent, whether they were living with family or they were living alone, and bringing all those together for each of the 4 neighbourhoods so we could try and get an idea of what people in those places thought. You can't read this tool, I don't think, but this was the bringing all that information together. What are the issues affecting people in the 4 neighbourhoods? And living on your own was the key. That was the one that was the highest one in the 4 neighbourhoods. That was the biggest issue about being lonely, was living on your own. Bereavement and loss was the second. Just being older, but lack of youth facilities came fourth. Yeah, so it was key that there was people. Now, in the 4 different areas, there were obviously different things as well that came out. These were very, very different places, and the people that came forward reflected that. So if you went to Denhoe, actually, most of the people who volunteered and came forward were older people. On the face of it, Denhoe had a lot of assets. It had an engineers institute, it had a lot of things going on, but there were a bit gatekeepers, if you like, by certain groups of people. And what the project actually did in Denham was cause a bit of a coup. So there were seats lost from the parish council, and the council was harassed so that you didn't have to drive, you had to go to Keighley to get the key to go into the engineering union. You had to ask permission of the council. But it was the main asset within the place. So slowly over time, that changed. If you went to Bradford Moor, we had to change the project a little bit at Bradford Moor because it didn't take off in the same way as it did in the other three neighbourhoods. And part of the issue was there was isolation, but there was quite a lot of fear in that neighbourhood about putting your head above the parapet and standing out. It was a higher crime area, there was drugs dealing, etc. It was a difficult area for people to manage. So we took a different approach. We had to change the way we approached it halfway through the project, going for a more agency approach of established organisations in the place as opposed to just people on the street. And it did have an effect. One of the outcomes of the Bradford Moor area is now there's a cultural market that happens quite regularly, where all the different diverse groups, Eastern Europeans, South Asians, would come together around food. Yeah, around food and diverse culture, which is a sort of a fairly neutral but very positive, area to share difference, and that seems to have worked extremely well. Members in the different neighbourhoods came up with over 1,000 ideas to reduce loneliness, and we had to work with them to really bring that down, to prioritise it into an action plan that could actually be delivered. And that looks different in each place, very much different in each place. And the community researchers, because the project actually finished at the end of 2013, and the project manager withdrew from the work, and we were thinking, what's going to happen? Is it all going to just collapse and fizzle away? And thankfully, that doesn't appear to have happened, or at least not yet. So in New Earswick, there's a group that's called Nelly, which is the New Earswick Less Loneliness Initiative. And they have a number of activities that they sort of talk about, community allotments. They've got a cafe that runs from the folk hall, which is thriving. In Denham, there's a food club every week or month now in the Engineers Institute. That's been really good about getting people together. They actually have an app. I've got the app on my iPhone, and not that I go to Denham very often, but you can press the app, it tells you what's on, it gives you the key contacts in the village, it tells you when the film night is on, when other events are on. It's a really interesting way of keeping community involved. At Bradford Moor, there's the community market, and there's a confidence group. I mean, that was the word that people chose. Big issue around confidence. You need confidence to just be able to go out and talk to neighbours. Car Connectors are the car estate group. They're working with a local church, they have a pop-up cafe, they work with the children's centre, and again, all looking slightly different, but each area still has an identity that was a legacy of the project. Key messages. There was an evaluation done which evaluated the programme over 3 years, and that was published in July of this year, and is on our website if you'd like to read it. But the key messages were quite interesting. Going the medical research, etc. But loneliness kills people, literally kills people, but it also kills communities. It's difficult to have a good community if people are lonely behind their own four walls. Another interesting one was this concept that regulation kills kindness and reduces action. In all four areas, people were very keen and very able and willing to do things that might prevent loneliness. What they were really worried about was trying to alleviate loneliness. And it was a strong theme throughout that people thought you weren't allowed to do things. So there's something that you're not allowed to go around and knock on people's doors and just see who they are if you haven't been introduced or have a badge or have something. You can't just set up a little toddler group and invite people around for coffee because those people have to be police checked and things like that. And it's quite interesting that how that really did sort of stop people from doing things that they thought might be useful because they just thought that they couldn't do it. Unless, of course, you get the snow effect, and that was because we had a couple of banks of snow during the project, and all the neighbourhood sort of reported that the world changes when it snows, and suddenly you don't ask questions anymore. It's perfectly all right to knock on people's doors, it's perfectly all right to offer lifts to old people on bus stops and take them home, and nobody thinks twice about it because there's the emergency, and it's all right, everything's forgiven, you're allowed to do it. When the snow goes, you're not allowed to do it anymore. It's quite an interesting thing, you know, that stops people doing it. Building personal and community confidence builds community resilience. And one of the aspects that we completely tangent really to what the project was about initially, but was a really interesting unforeseen outcome of the community researchers. They kept dropping out through the programme, we kept recruiting other ones, but people kept dropping out. They didn't drop out because they were bored, they dropped out because they were getting jobs. And you know, if you in the evaluation, we talk a little about this, but it did seem to you know, people who were a bit lower themselves and you know, sort of got involved in the project, gained confidence, gained the ability to talk to people, gained the ability to be part of something. They weren't being paid, and they went off and they got jobs, and they'd been unemployed before. And it also raised some of the strange thing, you know, somebody who is unemployed or on benefits and gets involved in their community, they were also getting into trouble for volunteering and having threats to their benefits, which was a bit bizarre when actually what it was leading to was employment. So there were things that sort of, or at least the perception that it got in the way. You know, don't tell anybody I'm doing this because I'll get the benefits, but you know. There is the other things that came out is the contradiction between our sort of societal ideals and our individual experience. So we would all sit in front of Panorama or something, touching, you know, those poor old people who are so lonely in their own home, but none of us knocks on the door on the way home. Yeah? We might put a few pennies in a box sometime, but actually we're so in our own sort of bubbles that we don't often, just in our own neighbourhoods, never mind, we might do it as part of our work or you know, our church activities or something, but we don't actually do it much in our personal sphere, or not enough of us. So in talking to the neighbourhoods, one of the most difficult things in the end was disengaging, because we tried very hard to keep at an arm's length type of relationship with community researchers and the community so that we didn't become too dependent when we left, if you like, because there were no additional funds to keep things going. So we did ask them to look at, you know, what would their groups do, what would the neighbourhood, how would they keep it going, and how would they try and develop this personal and professional. It's not all about professional, it's also about the personal. And the neighbourhoods were slightly different. The two in York and Denholm more or less said, yeah, thanks very much, you've done your bit, now we'll get on with it, because you know, we feel quite confident. Bradford Moor wasn't a bit different. We have left a bit of a legacy there of an existing community researcher with some funding, and just building those relationships. Also about language and translation as well, that she's very good at, which is helpful. So we actually think it was quite an interesting research, action-based project. We learned quite a lot from it. We certainly didn't solve loneliness in those areas, but we raised it on the agenda in those communities. And I think it was the unforeseen thing was that those communities are a little bit more resilient and a little bit more self-identified than they may have been before the project started. And in hindsight, we could have done it around dementia, we could have done it around, you know, you could have used various different roles actually. And the evaluation showed that the most important thing was the process, not the subject. It was about getting people, local people in their neighbourhoods engaged in it. From the outcomes, there is a loneliness resource pack which is available on the website. And this is a sort of toolkit for any community or neighbourhood that might want to try and replicate some of this work about how you might go back to, and what are the sort of difficulties around. We've done a few can-do things, so I can't remember what we called it, Red Box or Red Tape or something. An organisation that's done some little animations about a bit of myth-busting about what you're allowed to do and what you're not allowed to do. You know, if you want a street party, actually you can just have a street party. You know, if you want to have a toddler group or a parent and young child group, you don't need CRD checks and things like that. You know, I mean, it's just about myth-busting to give people the permission to actually engage with people. And there's also some short films as well on the website. So anybody can be lonely, even busy people, but everyone can reduce loneliness, their own or others. And this is the bit which came out as well, and it came out of another piece of work we did on Dementia Without Walls, which was, you know, we all have a responsibility, not just in our professional lives, but as people in all the groups and other people who we deal with, to try and understand these issues and to talk about them. Nobody is in Ireland. I think that's what that's supposed to say. Any further? Thank you very much.